Hello, my name is Jasmine Valdez. I'm a student at Washburn in the OTA program, and I'm going to be presenting today for my fieldwork presentation. My presentation is about balance and fall risk in the geriatric population. My project is about balance and fall risk in the older population. People that are 65 years and older are more at risk for falls that result in broken bones, head injuries like TBIs, and these falls account for 95% of hip fractures that happen and 25,000 fall-related deaths annually. One fall risk increases the risk of more falls in a person, and that also decreases their confidence in transferring and being more mobile in their lives, like doing more activities. Their fears heightened because of falling one time. They don't want to fall again, so they're scared to do anything that will put them at risk for falling. This causes reduction in engagement in meaningful activities that they find meaningful to them, which also may cause depression and sadness in their life. The medical cost for fall-related injuries comes up to more than $31 billion a year, and there are some fall risk factors that we can look at. One of them is biological, another one is behavioral, and another one is environmental. So let's go through all of those. The biological risk factors include weakness of the lower body, chronic health conditions that limit them in their daily lives, a deficiency in vitamin D, medication side effects that can affect maybe them being dizzy or them being weak, vision problems, which would include like problems seeing because of lighting, or just vision problems in general, cataracts, or any visual conditions. Decreased sensation, which also could be visual problems as well, and foot pain. The next one, risk factors are behavioral, which would include inactivity for any reason, like we talked about earlier. They could be inactive because they're scared of falling again because they've already fallen once, or they might be sad or depressed because something has happened in their life, like a recent change in environment or a recent change in lifestyle. So they don't want to be as active as they used to be. Substance abuse can also be another one, either medication-wise, like pain medicine, or any kind of illegal drug can alter a person and put them at risk for falls. And unsafe behavior like standing on a chair or climbing a ladder if they're not supposed to be doing that because they have issues with their balance. Now let's talk about environmental risk factors. This includes clutter in a person's environment, like their room or their house, tripping hazards, I would say like rugs, throw rugs, or even pets, because they like to hang out like right by your feet, and maybe you don't know, or they don't know that the pet is there, and they might trip and fall because of the pet. Another one is poor lighting. There has to be a lot of light, especially for elders' eyes, so that they can see everything very well, and make sure that they don't trip with something because of poor lighting. Lack of grab bars and stair railings. And these are very important because If there is no grab bars or stair railings, there's nothing to hold on to just in case of imbalance. Some things that can help improve balance are dual task and multitask exercises. As OT practitioners, we can use a variety of fall prevention exercises and interventions to improve the fall rates of the people that we are taking care of and the risk of falling, improving balance and strength in our therapy sessions. In my setting, the patients that I am treating, for the most part, need a lot of fall prevention interventions or improvement in balance. This is so that they can perform their ADLs, like dressing, going to the bathroom, taking a shower, and cooking if they're going to go back home on their own and safely. Our goal is to always help our patients become as independent as possible so that they can perform all of their ADLs and their daily task routines that they have at home or wherever they're going to go to with confidence, so that they're not scared that they're going to fall or something might happen to them because their balance is off. We are trying to prevent any more falls happening because if they have fallen once, they're going to be super scared to fall again. And it puts them at risk, even if they fall once, puts them at higher risk to fall again in the future. So for my placement, I chose to teach the people that work there the Ballet Vis X exercises, which stands for balance, auditory, vision exercises. It was made by Bill Hubert here in Kansas, and he was a teacher and also a martial arts teacher as well. This program is made of 300 exercises with sandbags and also a use of a balance board if needed. It makes it more complex, or you can also make it as simple as just sitting in the wheelchair if your patient is wheelchair bound and passing the sandbags back and forth and in different patterns, like tossing or going behind their back, and also putting them around their head or around their waist or around their knees or around their ankles. So this method and exercises has been tested from kindergartners all the way to the elderly population and helps with balance. The cost of this program online is, the book is $25. The DVD, which shows you a lot of different exercises, $65. And the balance board is $100. The sandbags are $250 and the bounce balls are $135. For the presentation that I did at my site, I looked up different exercises on YouTube, which there are a lot of videos that help teach like group exercises and also individual and partner exercises. And I bought bean bags that are about the same weight, which should be 10 ounces. I found some 12-ounce ones, which worked just fine. And instead of the bouncy balls that they sell online, I bought some racquet balls, which are good for this use because they bounce pretty good like the ones that they sell. For the balance board, we have some balance boards in our gym that we could use if we want to make the exercise harder for a patient that is more or highly functioning. So why did I choose Balabus X? Is because I find that they weren't using it in my placement, so I thought it would be a good addition to our treatment sections, our treatment sessions, so that we can just add something new and that would benefit most or all of our patients with their goals. So when people stay active, it benefits their health and it helps them out instead of them being inactive. A fall is considered an unexpected event in which the participant comes to rest on the ground, floor, or a lower level. If they had falls in the past, talk about them with them and ask what caused the falls. Sometimes they may be embarrassed to talk about it because they don't want to admit that they have fallen, but it is very good for us to start that rapport with our patients so that they can trust us and let them know that we are here to help them and we are not here to judge them about anything, and we can help them find ways so that they can be safe in their environment wherever they're going to be at. And then also, if you're going to ask them, like, how do you go to the bathroom or how do you transfer, it's better for us to see, because they can say like, oh, I'm independent or I can do everything on my own, but maybe when you actually see them do it, they might be holding on to like a towel rack to help them, or they may need a riser in their toilet. So it's better for us to observe them actually doing it and making sure that what they're telling us is accurate according to therapy standards. What are some fall prevention interventions? Let's talk about 5. There is multidimensional fall risk assessment and risk reduction. This uh, intervention targets multiple things at one time. So either medications or environment, all of that, it is targeted at one time with this intervention. The next fall prevention intervention is exercise-based intervention. This will help with endurance with the patient and also with the balance. The next intervention is environmental assessment and modification. Here we are looking at how safe the environment is or the home is. We can also make a checklist to make sure that things around the house are safe and that we are taking as many preventative measures as we can to prevent falls from happening in the future. Institutional approaches, which include anything that a hospital does, anything that a nursing home does, or an assisted living to prevent falls. Like, for example, a hospital can put a one-to-one sitter with the patient that is a very high fall risk so that they won't fall. A nursing home can institute a fall prevention program, which they teach all of their employees to help prevent the falls, like make sure they have their grippy socks or shoes on. If you're walking with somebody that's a high fall risk, to wear a gait belt, etc. And then the last one is multifactorial approaches, which is medical management. It includes medical management, but it's also a client-centered approach. Anything that you feel like it's not working medically, we also have to reach for our peers like doctors and nurses and ask them, like, do you think that this medication is putting them at high risk for falls, or if there's anything else that we could use, or lack of vitamin D, stuff like that. And client-centered approaches that we can as the patient and involve them in the care of fall prevention, um, giving them information about it, and letting them know what we're doing it for and why we're doing the things that we do is to help prevent them falling or help prevent them from being at risk for any falls. That is the conclusion for my presentation. Thank you.
Hi guys. I'm going to be presenting today about a program called Ballet This X. It stands for Balance Audio Vision Exercises. Go ahead. You're okay. Has anybody ever heard of it?
I think I have. Is that my first one? Nope. I have. I've been to a training.
Oh, you have? Okay. So there's a training for it made by Bill Hubert. He was a teacher and also a martial arts instructor who made this program up. It's made up of 300 exercises, either using sandbags or racquetballs, and it's mostly for balancing and for doing visual acuity and tracking. It started in a first grade classroom, but it has been used with kids from kindergarten all the way to senior adults. And it also has been helpful with TBIs and PTSD patients. So this enables the whole mind-body system to work together and to create a symmetrical flow of like a pendulum effect. Since we are going to be working with right and left side, left hemisphere of the brain, and so the body can work together in that way. Anybody have any questions? I'm gonna also do kind of like a few exercises if somebody wants to come up and help me. Okay.
Of course, Hunter.
You need me now?
Go ahead and finish your lunch first, Hunter.
I was just gonna bring it up there and balance.
I can help.
Okay. Yeah, since you've done it.
Just mean I'm any good at it.
I feel like it's kind of hard to get like started because you have to have like a rhythm and all of that.
Don't stand in front of me, I don't want hit.
So
They use it mainly with the kids in the schools.
Yeah, it's used mainly with kids in schools, but I feel like we can incorporate it here because it's not very hard either.
No.
So the first one we're gonna do is we're gonna go around the head and then up, down in our knees. And this will help with dressing, like lower body dressing, upper body dressing. If they need to do their hair, just to start out an exercise so they can get themselves moving.
Yeah, I never learned this one.
Well, there's like
Yeah.
more than
I have
300.
I used to have the book.
I found the book on Amazon. This will help tracking the different colors so that they can track theirs.
This would be good sitting or standing.
Yes. And then you can upgrade if they need like balance and all that stuff. Then you can also press it to your left.
Press 3, unit, press 3.
And then up. And then also left and then back. And then you can do just a few with fall.
So those bags, are they specifically for that, or you can just buy any?
No,
beanbag?
it says that they use a 10 ounces, but these are 12.
Okay, so just any beanbag that are
Yeah.
10 to 12 ounces.
Press it and then bounce. Press and bounce. And we can also do this in like a group and add more people to it.
Did you do that with the tennis ball? Have them walk?
Well, that's why I actually stole the idea, so. But a tennis ball doesn't bounce as good.
Carl, room
And then
226, please. Can I get
I'm
Carl?
gonna give you 2 balls and we're just gonna bounce. little harder. Ready?
So what, are we doing
We're
both
gonna
at the
bounce
same
it.
time?
Yep.
Okay.
1,
I do mine after yours.
yeah, 1, 2, 3. Then at the same time.
I thought they hit each other. Okay.
Ready? 1, 2, 3. Oh, I think I went too far
That is
away.
hard. I think that you do yours first and I do mine over.
Okay, ready? 1,
Uh-huh.
2, 3.
But I haven't done that one for a while, so I don't know. It's, you get all that auditory
Yes.
for rhythm.
Yeah, so you can hear the rhythm, and then you can also, with different color beanbags, you can do the tracking of the moving around and all of that. So that's my presentation.
Cool.
Thank you.
Good job, Mike.
Very good.
Okay, copy the feedback. Look at the screen. Hey, fine. Fine. Both hands. Huh? What? Turn your head. Yeah. Go. Alright, just bounce one of them. Now the other hand. Now you're gonna do it one and then the other. Ready? Same time. Can't you go ahead and have two different? One, two. And backward. One, two, three, four. Okay, do that one again. Let's pause. Ready? 1, 2, 3, 4. We're gonna go behind our back. 1, 2, 3, 4. Again. Pause. 1, 2, 3, 4. 1, 2, 3, 4. Again, toss. 1, 2, 3, 4. Behind your back. 1, 2, 3, 4. Toss. 1, 2, 3, 4. 1, 2, 3, 4.